Hey, I heard you had wrist pain. My name is Dr. Jessica Henry, and today I'm going to show you how to K-tape for your Dequervain's tenosynovitis. So when you have Dequervain's, I'm guessing a lot of people are wondering what that funky word is. That means you just have a little bit of radial-sided wrist pain. Oftentimes it's associated with inflammation of that first dorsal compartment. That means that those thumb tendons over here are often inflamed. Oftentimes, it's when we're putting pressure whenever we're lifting. I like to call it new mom syndrome. So, one of the things that we can kind of do is use K-tape to reduce some of our symptoms. So, what I'm going to show you how to do is to K-tape for Dequervain's. You're first going to take a piece of tape, maybe about 3 to 4 inches long. Make sure it's shaped like a Y. You're going to go ahead and rip the two ends so you can apply them on the dorsal or the back side of the hand. So one is going here. We're going to give it a nice stick, a nice rub. The next one we're going to stick here on the thumb because we're going to help lift the thumb a little bit. This is when we're going to use one of our fingers to kind of brace while we give the thumb a little bit of tension. Remember, we do not tension the ends, guys. Then we're going to go to the next side. We're going to give him a nice little smoothing. We're going to peel him. So now we have a little bit of freedom. Our Y is free. Now we're going to add a little bit more tension, pull to about 50%. And this is when we're going to go ahead and relax the end. Remember, we do not tension the ends. Here we are, ladies and gents. We're going to go ahead and smooth. We should feel a little bit of help pulling up into extension for the thumb, and we should feel a little bit of help pulling into radial deviation and a little bit of an extension. For good measure, we're going to take another piece, about this big, about the shape of your head. I'm just kidding. Cut it about 4 inches long. You're going to go ahead and stick it right where that pain is. You're going to go ahead and give them a nice little stick there. So tear it in half, give it a nice little stick. And what we're trying to do is we're trying to hold down that retinaculum. We're trying to give them a little bit of support. So I'm going to add a little bit of tension there. I'm going to wrap it around the wrist, give it a nice seal on the other side, smooth it out. I'm going to do the same thing on the back side of the hand and smooth it out. There we have self-taping for Dequervain's. You're welcome. The more you know. More information at Hands-On Neuro Rehab. And if you're interested in rehab for Dequervain's, we have a guided home exercise program and hand therapy toolkit with K-tape and a whole bunch of my favorite tools to help you rehab at home. See you soon.